going to lock down the country without the consequences, or particular areas of the country. A government, a responsible government, is required to look at all the implications before decisions are made.
This sparked speculations across the country. The impact was felt at the country's bus terminals. Many who had traveled to different areas of the country had to catch buses to return home.
Because of the virus, we have no job. Our job has lost. So if you stay here, we can't get anything to job. So we have to travel to our hometown so that we can cater for ourselves there.
I was in school, but due to the virus, I need to go home because they've been closed on every school, so I have to go home.
They said they will lock out the market for some weeks or months. So I know I cannot survive with that here in Accra, so I have to go to my hometown. When it's over, so I'll come back again.
The way they hear that matter now, I think plenty people won't go back and don't know. So now I think our bus is full. Our bus is taking 45, 49. The way that matter come now, we not follow on present or what. We reduce ourselves. The bus is taking 45, but we are taking 40. The one taking 49 is taking, no, the 45 is taking 35. The 49 is taking 40.
The markets were also flooded with many who wanted to purchase and store enough food.
We're still in the Agyeman market where there's as much human traffic as a vehicular traffic. Obviously, this should tell you that people have really trooped into the market to get their essentials, to buy produce, to stock up in anticipation of the lockdown, which is expected to begin from 1 a.m. on Monday, March 30. And so basically, that is the situation here at the Agyeman market.
Others called for support services before the consideration of the lockdown.
For a lockdown, it can be, but at least measures need to be put in place. They need to educate us, some of us. The elders in the area, at least they can come out by, if it should be the social distance as they are talking of, very good. But a total lockout whereby nobody will come out, I think it will be very difficult for places like.
Those who you are seeing here, they are not from here. They are from different places to come and buy the fish. When there is no fish, they will not come. That's why we are saying to the drivers to schedule their bringing goods.
Effective 1 a.m. on Monday, 30th March, some 48 hours from now, I have imposed, pursuant to the powers granted the President of the Republic under the Imposition of Restrictions Act, 2020 Act 1012. Restrictions on movement of persons in the Greater Accra Metropolitan Area, GAMA, which includes Awutu Senya East Municipality, and the Greater Kumasi Metropolitan Area and contiguous districts for a period of 2 weeks, subject to review.
The restrictions on movement, which lasted for 3 weeks, enabled the Ghana Health Service and the Ministry of Health to catch up with the ravaging virus.
We had a national response, and this was first was to limit importation, and that's why we started introducing the declaration form at the airports and our border points so that we can identify those who are coming in. We're taking their temperature, we'll find out where they are coming from. Because at that time, there were few countries where we had cases. We could say, oh, if you are coming from China, you're okay. But if you are coming from Togo, because there's no case in Togo, then you are not at risk. So that's how we have started.
We were trying to identify the cases that we had and then the contact of the cases. So now we are trying to enhance our contact tracing. So that was the time that we started doing what they call the enhanced contact tracing. So it's about trying to identify the contact of all cases and then following them up over the 14-day period.
It was described by analysts as one of the effective tools government deployed to fight against the virus. However, it took a toll on many Ghanaians, especially the vulnerable. The situation became dire, especially in the country's slums. It appeared government did not consider the socio-economic realities of the low-income Ghanaian, making life unbearable in some communities. Due to the restriction of movement, intercity traveling was also distracted. However, there were exceptions for some categories of Ghanaians. An attempt by some head porters to escape the hardship in Accra during the period to their hometowns in the northern region was foiled by the police. The head porters, numbering about 35, were directed by then Municipal Chief Executive for Ejiso in the Ashanti region to return to Accra in their cargo truck after police at Ejiso intercepted the 2 trucks which were transporting them to Wale Wale in the northeast region. This became a national conversation.
Me buy my new bus me no po. And almost say yare na omu buy no. Nti omu bebre kwedwuma. Omu bebre kwedwuma no enso yesu yetama so say ye be ko no for ekodo. Nti omu breka sika kakra yenye no ye diti ha ye be sa de toduane edi. Enitu na esi ye di sa ska ne be ye lori fe na eko. Ye kone krom edwuma no tama so na ye edwuma no ye wi na asaba tama omube bie edwuma no wa ha no na esu ye edwuma na wi na ya ba kra asaba ye edwuma kakra enitu na ekone ye fra na 4 days.
Government, in collaboration with the security agencies, formed Operation COVID Safety. It was a joint security task force which enforced the lockdown in the Greater Accra and Greater Kumasi areas. The enforcement of the lockdown regulations resulted in some isolated cases of brutalities in the early days.
Well, we did not go far where we saw some soldier men. You know, see my
They beat you?
They beat me, see my back.
Wow.
So the soldier people beat us and said we should turn the car back to Accra.
The Ghana Armed Forces denied these allegations. In a statement signed by its Director of Communication, Colonel Agyeman, it noted that videos which circulated on social media depicting acts of brutalities were doctored and recycled videos of past events, some of which did not occur in Ghana. The lockdown indeed altered how people lived and negatively affected some businesses. A visit by Citi News to parts of Accra showed that generally many complied with the lockdown.
Only few people move, those health workers. In my place like this, my wife is a nurse and my children are pharmacists, so they have moved. But the rest, they
Everybody's
are
at home.
Everybody is at home.
The partial lockdown flattened Ghana's case count during the period. But could there have been an alternative?
In trying to address the pandemic, there are several interventions that you need to interplay. So that you can synergistic effect, you can get the maximum impact you want. So to us, it was good. I remember even, let's say when we had this surge, people started talking about, let's lock the country down. But the idea is, lockdown alone is not the solution. But it's about the behavior change, which is the issue. Because as I said, the virus moves with an individual. So that's why if you look at some of our prescriptions, we're saying if nothing very serious, stay at home.
President Akufo-Addo announced the lifting of the partial lockdown on Sunday, April 19. At the time, COVID-19 cases surpassed 1,000 and a number of people expected an extension. It's been over a year since the lifting of the partial lockdown. But were there any lessons from the exercise, and were the objectives really achieved?
I would say that it was somehow successful, but we realized that when we tried to put in other measures like trying to share food, it also came about with a lot of challenges. So we said that now that we're able to understand the disease that is now community spread, let's now go for our main intervention. That's the 3 T's. So that is the testing, that's the tracing and the treatment. So we moved on to carry on with 3 T's, and that's what we have been doing ever since till now.
Ghana will still need to learn some hard lessons about better surveillance, improved testing, and the need to build a robust health system. We would also have to learn them quickly, not just for today's pandemic, but for the future as well.